Hello everyone. Today we are going to discuss some basic concepts regarding pathophysiology of COVID-19. My dear friends, the basic pathophysiology of COVID-19 is that it occurs in three phases. First is the early phase, second is the phase which occur in lungs, and third is inflammatory phase. So my dear friends, just remember COVID-19 is an infection which is spread by droplet infection. So first of all, it enters into the nasal cavity. Here there is ACE2 receptors, and this virus binds with that receptors and gets killed in nasal cavity if your immunity is good enough. So in 70 to 80% cases, virus gets itself killed in the nasal cavity as the body immunity is good, right? Once the body immunity is little bit compromised, this virus gets its dominance over the body immunity and it enters the lungs. Once the viruses enter into the lungs, the actual phase start. In lungs, what happens, my dear friends, that a outside antigen has come into a body, so body would try to fight with that antigen. So in this process, the body sends neutrophils to fight with the COVID virus. So there is a fight between body neutrophils and the COVID virus, and due to this fight between both two, there is a damage to the lung epithelium. ऐसी ही बात है कि दो इंसान के बीच झगड़ा चल रहा है, तीसरा इंसान बीच में रोकने आएगा, खुद मार खा जाएगा. Like that only, COVID virus and body neutrophils are fighting, leading to collateral damage to the lung epithelium. Ultimately, patient landing up in respiratory arrest, developing hypoxia, and fall in saturation. So this is the phase which is occurring in lung. This is the second phase, and the last phase is an inflammatory phase. In this phase, what happens, the body neutrophils are there to fight with the virus, but the viral load is so much in number that the body neutrophils are less in number. They cannot fight with large number of virus. Suppose there are 1,000 virus and the body neutrophil number is 10. How would this 10 फाइट विद दैट 1,000? सो दे नो कि हम तो मरने वाले हैं, तो ऐसे ही है कि हम तो डूबेंगे सनम, तुम्हें भी ले डूबेंगे. तो लाइक दैट ओनली, this 10 neutrophils act as a suicide bomber, and they kill themselves in order to destroy as much as virus they can. So they act as a suicide bomber as they maintain their loyalty with the body until their last breath. So this neutrophil would act as a suicide bomber and try to kill as much as virus they can until their last breath. In this process, there is release of large number of inflammatory mediators and interleukins, ultimately leading to multi-organ damage. So inflammatory phase, this is also called as cytokine storm, and interleukin 6 inhibitors toxelizumab is given in such cases. So this is a basic pathophysiology of COVID.